Is stem cell therapy less expensive in Mexico with R3 than it is in the United States? Yes, it is. This is Dr. David Green, founder and CEO of R3 Stem Cell. Let me explain why. In Mexico, there's a few things that are beneficial for us. One is our cost of doing business is lower. We have beautiful facilities, but the rent on those is significantly less. The doctors are very, very nicely trained. They offer very safe treatments, but the salaries in Mexico are lower. So our cost of doing business is less. But when it comes to the biologics themselves, we're able to culture those stem cells at our lab in Mexico. The tissue actually comes from UCLA. But when it comes down to being able to culture, we can offer a lot more quality stem cells for patients at a much reduced cost of goods, so to speak. So we use that buying power to bring the cost down. How much down? It depends. It may be a little bit less than half of what we charge in the United States. It might be 25% less. As more and more stem cells are needed, the cost savings, it becomes more prominent, okay? But when you look at, comparatively speaking, what it costs to get stem cell therapy with us, what your investment is going to be compared to our competitors, whether it's in Tijuana, Colombia, Panama, or whatnot. We have 2 clinics in Mexico. It's night and day. I mean, every week we see quotations from these other clinics, and I'm like, where do they get off thinking that that's appropriate to charge that amount for a patient who's probably going to need repeat treatment every 6, 12, or 18 months in order to continue to do really, really well, avoid a transplant, dialysis, or things like that. So for instance, if it might get a quote from Panama for $25,000, we're probably going to be around 10, okay? It's very, very important for me to bring these therapies to patients in need at the most cost-effective way possible, all right? The investment for you needs to be something that is doable on a repetitive basis if necessary.